Would you like to know what hospitals of the future will look like? I can show you that right now, and I don't need a time machine to do it. First, do no harm. That's a guiding principle of modern medicine. But over the last 2 years, many hospitals around the world have broken this cardinal rule, installing IT systems that actually made it harder for their medical staff to deliver care. This is CUHK Medical Center in Hong Kong, and I've travelled 8,000 miles to visit it because it solved that problem by integrating advanced comms technologies, including cloud, with healthcare applications.
The CUHK Medical Center is a private teaching hospital wholly owned by the Chinese University of Hong Kong. We are contributing to the Hong Kong government's reform initiative in the private sector, trying to bridge the gap between public healthcare and private healthcare in Hong Kong.
Hospitals are usually organised around traditional divisions, building infrastructure, IT, different departments, and so on. But CUHK Medical Center isn't like that. Everything here is data. Biometric data, closed-loop logistics and location data, telemedicine video data, all being used in near real time by those applications that make up the clinical ecosystem.
Right from the outset, when we designed the system, we want to make it very clinically friendly, to the clinicians, to the doctors, to the nurses, to the allied health professionals. So they were in the driving seats in developing the system to make sure that it would dovetail with their sort of workflow.
All these IT systems and components within this hospital is a pretty complex system, which covers the whole patient journey from the patient booking, admission, triage, consultation, and during the stay of the hospital until the patients got discharged. So we have to build this system from scratch within a short period of time. That's probably less than 3 years' time. So that's very challenging. We are utilizing quite some new technologies. And some of these, when we're still planning for this hospital, they were not commonly used in a hospital environment.
We have deployed different wireless technology in here, and ultra-wideband is one of them. We will deploy this wristband to patient, and we can see on the map where is location in the hospital in real time. Once the patient is out of the range of the ward, our clinical staff will get an alert, both on the system and also on the mobile devices.
One of the most exciting uses of technology here comes from Huawei. In this designated room, the hospital is trialling millimeter wave radar technology to perform contactless biometric measurements. They can measure things like a patient's respiratory rate or their heart rate without any physical contact with the patient at all. And using this sensor in the ceiling, they can also tell if a patient has changed position. For example, if they've fallen and need help.
The CUHK Medical Center is the first hospital in Hong Kong to have full 5G coverage in the hospital premises. Being a teaching hospital, we often need to hold teaching classes to medical students. Doctors can wear these smart glasses and live stream to the auditorium where the medical students are. The professor can communicate with the students to teach them how to do surgeries in real time.
Adding digital technology to healthcare is nothing new, but it can cause more problems than it solves, creating digital silos that complicate workflow for the frontline care teams. CUHK Medical Center has eliminated that problem by focusing on tight integration of the new technologies with the healthcare applications.
At the pharmacy, we got the dispensing process automated. In the ward level, we got the administrative process, for the nurses, automated. So everything is automated. All our patient linen uniform and everything, they are RFID tagged, and that helps us a lot. Not only managing the sort of inventory of all the linens, but also reduce the manpower required for all these linen processes as well. And manpower is important, because healthcare on the whole is manpower intensive. It's not just the doctors, nurses, physiotherapists and all that, but it's also, a lot of people working sort of at the back end, back of house, to support all the patient care processes. So automation actually does help us to reduce the manpower need, and this is especially important in Hong Kong because in Hong Kong manpower cost is expensive.
The hospital here in Hong Kong isn't just a digital hospital. The team here has undertaken the development to move that paradigm forward, transforming it into one of the world's first smart hospitals.
The way we finance healthcare, the way we deliver healthcare is going to be different. And ICT, certainly the use of modern information technology certainly will have an important role to play.
Do you think deploying next generation technology, as you have done, has actually saved lives here at your hospital?
Definitely, patient safety is a very important aspect nowadays in managing of patient care. And ICT system is actually indispensable, for us to have better control, all these potential human errors, that takes place in a human-intensive processes. We as a provider, we have to work with the patient on one hand, we have to work with the payers on the other hand to create the total value. And so this will be a brand new sort of system that we are establishing. So hopefully we'll be able to move faster on that.
What an extraordinary facility this is. I know that if one of my family or friends needed treatment, this is the place that I would want to look after them.